it, and yeah, recording has started.
Okay, all right, perfect. So we'll start off with aggression. All right, are you guys able to see the screen?
Yes, sir.
Okay, perfect, perfect. I'll just unmute everyone else. So if you guys want to say anything at all, you can unmute your mic and uh, then tell it to me. Okay, so let's start with aggression. Can anyone just tell me a little bit about what aggression is? How would you define aggression? Yeah, anyone? Just give me a brief about what do you think aggression is.
Sir, it's a goal-directed abnormal pattern of behavior.
Right. So a couple of very important points. It is goal directed, and it is an abnormal pattern. Would did you say that?
I'm not sure, sir. I think it should be, sir.
Okay. So the easiest way to explain aggression, and this definition I think is given in Barron, is that it is a behavior essentially with the intent to harm an individual, and this individual is motivated to avoid this harm. Does that make sense so far?
Yes.
All right. So what would you say are the types of aggression?
Verbal and physical aggression.
Okay. If I were to further classify physical and verbal into two more parts, then what would it be? Active and passive.
Hmm.
And if I were to further classify that into two parts, what would that be? Direct and indirect. All right. With me so far?
Yes, sir.
Yes.
Okay. So this is what aggression basically is, right? And there are two main theories of aggression, right? Some are the hydraulic theories and some are the non-hydraulic theories. So hydraulic basically means that aggression builds up over a period of time, and then there is an outlet when the threshold of aggression is crossed. So if this were the threshold and it was crossed, then it would lead to a manifestation in the form of behavior. And the non-hydraulic theories say that there is no such thing as buildup of aggression, and it is just a manifestation of behavior, right? So the first person who gave this theory essentially was does anyone know who gave this who gave the frustration aggression theory? This is an important MCQ for your paper. Eh?
Is it Dolan? Dollard?
Yeah, great answer. Good answer, Swapnil. So it's Dollard who gave the first frustration aggression hypothesis. And what was it, Swapnil? What was the hypothesis?
The hypothesis was frustration occur when motivated behavior is thwarted or blocked or the goals are not reached.
Okay. So just to simplify that a little bit more, what he said was that whenever there is a goal, so this is a person's goal, right? And this is the person, and he wants to reach this goal. So whenever there is a roadblock in the goal, so there is a block. What will happen is that eventually the internal state that builds up inside us is something which is known as frustration, and the outward manifestation of this frustration is essentially aggression. With me so far? Is it all right so far?
Yes, sir.
Okay. So now what happens is that Festinger, Dollar gave this initial theory, which is known as the frustration aggression hypothesis. Then Festinger came in and he said that, well, it's not essential that every time frustration will manifest into aggression. So eventually, the thing that everyone agreed upon after a lot of thought and centuries of controversies was that frustration increases the chances of aggression happening, right? And there is this conditions apply that is very essential if given the right tools. And one of those main tools um, which is essential for frustration to manifest into aggression is this concept of de-individuation. Can anyone tell me what this concept is? So what do you notice? What is the first thing that comes to your mind when you imagine army, or when you imagine the navy, or when you imagine the air force? What is the first thing that comes to your mind? Anyone?
War, discipline.
Yeah, discipline, right? So how is this discipline? Would you say that this discipline is in the form of their uniforms, the way they are supposed to train, the way they are supposed to live their lives, uh,
Yes.
right from common types of haircuts to everything, right?
Yes.
What does this essentially mean when we say that their haircuts are common, their uniforms are common, their training is common, their routine lifestyle is common? What we are essentially doing is that everyone is having this exact same pattern of lifestyle. So there is no individuality that is given a lot of importance um, as far as these things are concerned. And that is why there is this theory that any law enforcement agency, right? Any law enforcement agency, or even any fringe military group, you can even take into account um, those the guerrilla warfares and all the people who are also fighting against the system, but proclaim to be freedom fighters or fighters of fighter against the establishment. You will notice this one thing, that they all have certain similar uniforms, they have certain similar training styles and a certain similar lifestyle. So what that does essentially is that it de-individuates. And when you're de-individuated, what happens is, does anyone remember the locus of control theory that we heard about during the previous session? Can anyone tell me the locus of control theory? I think Swapnil was there, Akanksha was there. Any one of you?
So the
Sir,
locus.
Yeah, Ankit, go ahead.
yes, sir. I think like some external forces are acting on some person, and beyond that, what control a person has in the events of his life.
Okay. Okay. Akanksha, would you like to explain it further?
So the locus of control theory gives 2 points: the internal locus of control and the external locus of control. So
How would you explain it in this context, in the context of de-individuation?
so in context of de-individuation, we have put the locus externally, I would say.
Exactly.
Yeah.
Exactly. So the locus of control lies externally in these people who are de-individuated. So whenever they are given this task of, say, uh, blowing up a certain number of houses, or in the case of terrorists, let's say that they are given this task of flying this airplane through a huge building, what happens is in their mind, the way they rationalize it is that they are not doing something which is their own decision. They are doing this for a greater good or for a greater purpose, or on the advice, or on the on as a larger thing. That's how they are supposed to rationalize this entire process, right? So what happens is that their locus of control is external, and that is why when there is frustration and it is given the tool, it is given the right tool of de-individuation, what happens is there are much higher chances of it converting it into aggression. Is this concept clear now?
Yes, sir.
All right, perfect. The other very important theory as far as aggression is concerned is the hydraulic theory, and this is one which is given by Freud, right? So how many of you are Avengers fans? Do we have any Avengers fans at all?
So not an avid fan, but yeah, a little.
Yeah, so you remember the Thanos
Yes, sir.
in the last part of Avengers?
Yes, sir.
And what does that mean? So Freud actually coined these words Eros and Thanatos, and he said that there are two basic instincts in every human being, right? And whatever our behaviors in our lives are a manifestation essentially of these two instincts, right? The Eros instinct is also known as the life instinct, and the Thanatos instinct is also known as the death instinct. All right. So according to him, what happens is that over a period of time, the Thanatos or the death instincts builds up, and when it builds up beyond the threshold level, it manifests in the form of aggression. So this is a basic view of the psychoanalytical theory of aggression, which is the Eros and Thanatos theory. The other hydraulic theory is the one of territorial imperative, or the territorial theory, to be simplistic. Is that so whenever there is an animal, and we have these primal instincts in us which want us to establish our territories. So whenever we feel insecure about our welfare, or whenever we feel insecure about our well-being, what will happen is that gradually over a period of time, those insecurities will build up, and once they build up beyond a point, again what happens is they will manifest in the form of aggression. So these are the couple of very important hydraulic theories. The most important non-hydraulic theory is the one that we discussed initially regarding Dollard and Festinger. And also in the non-hydraulic theory, a couple of very important points that they will ask you are the media influence. So how do you think media influences our manifestation of aggression? Can anyone just pitch in using common sense?
Sir, in this theory, sir, there is, I think, concept of threshold is not there as such. I think the external environment, something which provokes a person or that.
Yeah. So it is the media theory is, you're right, Ankit. It's not a hydraulic one. So there is no concept of threshold. It's a non-hydraulic one. And the way the media influences is it normalizes aggression, right? So every day you see a lot of television programs which normalize murder, which normalize violence, which normalize cruelty, and that's why it becomes a very active part of our roundtable discussions and an active part of things we openly talk about. And this may lead to social learning, wouldn't it? Because people will want to replicate, or they would want to mimic this behavior. So the media influence is not a hydraulic concept of manifestation of aggression, but it is a non-hydraulic one, and it's a very important one. The last concept, which is again a non-hydraulic one, is the genetic concept, that some people, because of their personality aspects, personality traits, like you would say that someone who's suffering from ASPD, antisocial personality disorder, is obviously much more prone to being aggressive or being violent than someone who is, say, a cluster A in the form of schizoid or schizotypal, because that person would like to keep to himself, not interact much. He would not have that bandwidth of emotions as well in the first place. So is it all right so far? Were the two theories of aggression clear enough?
Yes, sir.
All right. And the last thing that about the aggression theories, which is essential to discuss, is what are the predictors of aggression. So what do you think predict the chances of aggression in the future as far as any individual is concerned? This concept, please make sure that you get this concept very clear, because this is one thing that will come to you in your paper A, come to you in your paper B, and also come to you in your cast in the form of risk assessment, right? So you will need to do risk assessment of patients, and at that time you should be very clear about the things that you want to be looking for to make sure that this patient is risky. So it's something which will be very useful as far as your clinics are concerned as well, because that's how you will know that, I need to watch out for this patient, because this is a high risk patient. There is a good chance that he might do something which might harm himself or might harm someone else. So what do you think, just based on your common sense or based on your clinical experience, are the things which predict future violence or predict future aggression?
Recent history of aggression.
Right, great point. Recent history of aggression. Okay, besides that?
Aggression at an early age, like incidences of.
Is it all right if we say that childhood experiences?
Yeah.
So that would cover some childhood abuse, bad parenting, mimicking the childhood behaviors that he or she has seen.
Yeah.
Okay. What else besides that?
Substance use.
Substance, yeah. What else?
Psychotic symptoms, usually command hallucinations. Those.
Current MSc?
Yeah.
Organic disorders.
Organic disorders, yeah.
Gender.
Sorry?
Gender. Male gender.
Gender. Yeah, absolutely. Okay.
History of violence.
Yeah, history of violence is covered. Anything besides that?
Psychosocial stresses, sir.
Yeah. Personality traits.
Peer influence.
Psychosocial. Sorry?
Psychosocial peer influence.
Can you please repeat that again?
Peer influence. Friends, circle which is the location. The environment which is
Your voice is not clear. Can anyone just repeat what he's saying, or you can type it in the text box if that's all right.
peer influence. Friends, environment.
From environment, yeah. So psychosocial kind of covers it.
Yeah.
One thing which is very important is infantile attachment. Right. So can anyone tell me I know we are deviating from the topic, but then this is also again something which is very important for your paper A. Who gave the attachment theory? Yeah, I think someone just tried, but is not confident enough to say it out loud. You're right. Who was it? I don't know. It's all right. This is a safe space. You can just say it out. If you're right, then you'll remember it for being right. And if you're wrong, you'll remember it for being wrong. Anyone?
John Ball.
Exactly. And what are the types of attachment? Based on this experience, based on this experiment that Margaret Mailer, was it? Who was the person who did those experiments with the child and the stranger?
Margaret.
Margaret Mailer, right?
Yeah, Margaret Miller. So we have secure, insecure. Is it resistant now? I can't remember.
Right. So there is secure type of attachment. So 70% of the infants have a secure attachment with their mother, whereas some are insecure, anxious. So they keep getting anxious whenever the mother is not around. They cry too much. They can never explore their surroundings much because they need to stick to their mom. The other type is insecure resistant. So these are the children who would resist. Who once the mother goes away, they'll start crying, and when the mother comes back, they won't even be calmed by the mother because they would resist any type of contact with the mother. They would also resist any type of contact with a stranger. So they would just be difficult to calm down once they've started crying. And the other one is also, there's also a disorganized type of attachment. So this baby would not behave in any predictable way or form. There would be irregular patterns of laughing and crying. For some time, the baby would be disinhibited towards the stranger. And at the same time, sometimes the baby would be observed to not interact with the mother at all. So these are essentially the type of attachments that I can remember right now. I think there was one more, but I think this can give you just a gist of why it can predict future risks of violence. Is that all right?
Yes, sir.
Okay. So that essentially brings us to an end as far as aggression is concerned. Does anyone have any doubts or anything they want to discuss regarding frustration and aggression?
Sir, I have one doubt.
Please go ahead.
Sir, what is the difference between this aggression and violence, sir? How do we define both? I mean, violence and aggression.
So violence is essentially physical, right?
Yes, sir.
Aggression is behavioral. So it need not necessarily be physical. It can also be verbal. It can also be indirect. It can also be passive aggression, right? So because you have a couple of juniors and one of them you really like and the other one you don't, so whenever you have been given the responsibilities of allotting COVID duties, you would allot the COVID duties to the junior you don't like. So that's passive aggression, but that's not really violence, is it?
Yes, sir.
Clear?
Yes, sir.
I think violence is a direct active aggression.
Exactly.
Like if it's in aggression, if it is a physical aggression, sir, like suppose in both there is a motive to harm the other person or intention to kill. So
Yeah.
in that case, is it both are same or?
So violence, you can say that violence is a subset or a consequence of the behavior that aggression is. So aggression is basically a verb that this person is being aggressive or is showing aggression. Aggression is an act and violence is the phenomenon that happens. Does that make sense?
Yes, sir.
All right. Again, these are very, abstract concepts. So there might be concepts which are overlapping as far as these words and their implications go. But I think this does give us a working knowledge of when we can say that something is violence and when we can say that something is aggression. All right.
Yes, sir.
Okay. So anything else you want to talk about aggression and violence?
Where do suicidal behavior go in this aggression?
Right. So according to if you read the Freud's theories on suicide, it is internally directed aggression. Right.
Okay.
So when you take all the frustration about the outside world and you direct it internally towards yourself, then its manifestation of that emotion essentially would be suicide.
Okay.
All right. Any other things that anyone wants to talk about regarding this concept? I think we're almost running out of time as far as this meeting is concerned. So for the next topic, I'll send another link so that we can have clarity regarding the videos that we are recording as well. We can put this up essentially as just the aggression video. Is that all right?
Sure, sir.
Yes, sir.
Okay.